A comprehensive review titled Esophageal Cancer in Kenya, published in the journal Annals of Oncology in 2017, indicates that Kenya belongs to a high incidence region known as Africa's esophageal cancer corridor, with the highest percentage of young cases below 30 years. It has one of the highest incidence rates of esophageal cancer worldwide, but research on esophageal cancer in Kenya has gone highly unnoticed.
In the last 10 years, esophageal cancer was oscillating between the number one source of cancer deaths and number two. In terms of prevalence in the country, the common ones, of course, is breast and cervix, and then esophagus cancer.
Here, we look at what esophageal cancer is. Esophageal cancer is an abnormal growth of cells anywhere along the esophagus. People tend to think esophageal cancer and throat cancer are one and the same thing. Dr. Michael Mwachiro, a surgeon and interventional endoscopist, explains the difference between esophageal cancer and throat cancer.
Throat cancer is actually cancer of this part going forward. So that's the throat. It's where the food goes in, up to where your vocal cords are. And then the food pipe is the part of your body where the food passes from the mouth down all the way to the stomach. So that is technically what we call esophageal cancer.
Esophageal cancer happens when cells lining the esophagus develop changes in their DNA. A cell's DNA holds the instructions that tell the cell what to do. In healthy cells, the DNA gives instructions to grow and multiply at a set rate and to die at a set time. In cancer cells, the DNA changes give different instructions. The changes tell the cancer cells to make many more cells quickly. Cancer cells can keep living when healthy cells will die. This causes too many cells. The cancer cells might form a mass called a tumor, which can grow to invade and destroy healthy body tissue. There are two types of esophageal cancer: adenocarcinoma and squamous cell carcinoma.
Now, here in this part of the world in Africa, we see mainly squamous cell carcinoma of the esophagus, and around 85 to 90% of the tumors are squamous cell carcinoma of the esophagus.
The main difference between the two types of esophageal cancer is the risk factors that are involved. The main risk factors include drinking alcohol, smoking, genetic predispositions, gastroesophageal reflux disease, and the consumption of hot foods and beverages.
I think there's one more I'll add, which is smoke exposure, not from tobacco, but from firewood and what we use for cooking in the house. And we had an interesting study that we did out of Bomet County, where we looked at normal asymptomatic people and we measured the metabolites of smoke in their urine, and we found that the numbers in that county were higher compared to the rest of the world.
To reduce your risk of esophageal cancer or help in prevention of this cancer, prioritize a healthy lifestyle by avoiding tobacco and alcohol, maintaining a healthy weight, and seeking treatment for conditions like gastroesophageal reflux disease, GERD.
We have opportunities to intervene, that's what I would call it. So, for example, the hot drinks, people just need to allow the tea to cool. Don't drink it straight out of the cup. Drink it a little bit cooler. If you have, a kitchen, the old or the rural homes that have a kitchen that has no windows, to add windows to those kitchens so that the smoke can get out. So I think there are some things we can do to reduce the exposure that we have that can contribute to esophageal cancer.
Some of the signs and symptoms of esophageal cancer to look out for are difficulty in swallowing, painful swallowing, chest pain, pressure or burning, coughing or hoarseness, weight loss and worsening indigestion or heartburn.
The true symptomatic disease for esophageal cancer in the early stages, it's very rare. So most of the screening that we do is really in areas that we call high-risk areas. So we go to areas or populations that have high numbers of esophageal cancer. And so in our country, that would be in places like Bomet County, Uasin Gishu, the North Rift, Central Kenya, Meru, those counties, Coast, have been seen to have high numbers of esophageal cancer.
Kenya currently has no proper national screening guidelines for this cancer for early diagnosis. Due to this, most people are diagnosed at an advanced stage when they are already symptomatic.
But there's been some work done in China that has actually shown that if you start screening, you catch the tumors early, you are able to improve survival, which is number of years that these patients live, and also impact the number of people who die from this particular cancer.
Esophageal cancer treatment options include surgery, chemotherapy, radiation therapy, and targeted medicines. Other treatments include immunotherapy, laser therapy, and electrocoagulation.
The options available for treatment are now locally available, even including the newer drug molecules, the immune therapy that were costlier are not available. Now they are available in the country.
According to Dr. Michael Mochiro, there is a lot of research that is going on to try and further understand this cancer. Nuru Abdul Aziz for Willow Explainer.